Fluoride. You may have heard of this element. It is necessary, or it has told us that it's necessary for mouthwashes, for toothpaste, for our water supply. I don't know if it's necessary for the water supply, but often, the medical community jumps to conclusions when it has an inexpensive item in excess and, it needs a place to dump it. And so it's like, what are we going to do? We got to find some use for this thing. Let's put it everywhere. How do we consider, though, maybe every 6 months, every year, every couple years, fluoride treatment at a doctor's office or at a dentist versus every single day, multiple times a day, consuming fluoride? How do we consider the negative consequences? So I got 5 things to consider before making fluoride a regular part of your routine, or if it is a part of your regular routine, consider these things. So the first one, a big one, is your thyroid and the health of your thyroid and your thyroid function related to fluoride. So hypothyroidism, low thyroid function, this is one of the most common ailments coming against Americans. And if you suffer with it, the challenges of fatigue and bowel issues and anxiety, depression, and hair loss, all this stuff. So the deal is fluoride inhibits thyroid stimulating hormone, or TSH, output from our pituitary gland. And without a strong signal to the thyroid gland to make thyroid hormones like T4 and T3, their production decreases. But that's not all. Fluoride also competes with thyroid stimulating hormone receptors on the thyroid gland itself. So not only is the signal up here decreased, but in the thyroid itself, the ability to stimulate thyroid hormone production is decreased. And if we decrease production of thyroid hormone, we get hypothyroidism. So meaning fewer thyroid hormone is being manufactured, and to make things really bad, fluoride stimulates a certain G protein, this particular G protein, which has the effect of switching off the uptake of T3, and T3 is our most active thyroid hormone, at the cells. So we got problems with the pituitary, problems with the thyroid, and then literally at the cells themselves, what fluoride is blocking and decreasing thyroid hormone activity. Problems. All right, number 2, fluoride is much lighter from an atomic weight perspective and more reactive than iodine. And it ends up displacing iodine from the body. And if you remember your periodic table of elements, iodine and fluoride, those are both halogens. Also chlorine. With fluoride having an atomic weight lower than iodine. And unlike, getting a wrestling match, punching match, the bigger guy often wins. When it comes to these elements, the lower the weight usually wins out. That lower atomic weight means they're more active. And so you promote iodine deficiency everywhere. All right, number 3, let's talk about glutathione. Glutathione is the most important master antioxidant every cell in our entire body. Not having sufficient amounts of it, bad news. And fluoride actually inhibits multiple enzymes and lowers glutathione levels. This makes the body that much more susceptible to dysfunction and just eventual full-blown disease. Every cell being impacted, from your liver, your kidneys, your eyes, brain, you name it. Fluoride exposure also leads to cell membrane degeneration. It shortens the lifespan of red blood cells, and in the end leads to anemia. On top of that, fluoride, it's degrading the red blood cells, but it's decreasing iron storage. It's crazy. So now we have, increased bone marrow stress, trying to stay up with the need for more red blood cells because the red blood cells are being destroyed by fluoride. And we're missing the main ingredient because the body is having issues storing iron for red blood cell production because of fluoride. Okay, next up, fluoride really is, it's just an energy ravager. Whether we're talking about the thyroid, like we mentioned, we're talking about glutathione, we're talking about iron. There's also the fact that literally straight up fluoride depletes ATP production. ATP is the energy currency of our cells. And it does this by inhibiting this enzyme called ATPase. It's hard to argue that there could be any benefit that we would obtain via consistent fluoride exposure, put it in our teeth or drink it in water, compared to literally the catastrophic effects on our body from whole day in and day out fluoride excess, coming against us. So the number one way to decrease the effects of fluoride is to decrease its exposure. And for some with significant fluoride exposure, it can take years to overcome this, or potentially never overcome it that we're aware of. And there are many theories, many mechanisms being researched to help with fluorosis, or the disease state of excess fluoride. But as of yet, nothing really is consistently shown to benefit and help get people out of these situations. And on top of that, the 5 issues I mentioned above, it could be a 1% negative effect on the health of the person, all the way to straight up being bedridden from the fluoride exposure. And so much that depends on our own being, our own detoxifying enzymes, and our own iodine intake. So consider, is the amount of fluoride at a dental visit, or the amount of fluoride in your toothpaste, or the amount of fluoride in your drinking water, is that enough to promote an issue, or one of the issues I've just listed? And this is the thing. This is a great question, which I think a fluoride promoting agency ought to have to do significant research to answer before recommending across the populace fluoride, across the board. It helped this one kid with its teeth, we think, so let's just put it in everything. And given we have this shortage of health in America, we're lacking in health, I think it'd behoove us to consider whether fluoride, its use, is the most efficacious way to support the teeth, the oral cavity. Could there potentially be a way that's not a drug, that's not an element, that is destructive to so many areas, literally at the cellular level, on up to the glandular level, so many areas it's destructive? I think we've got to ask ourselves these things. And there's not enough people asking this question, and there's often answers that are just blanket answers, and answers based out of fear of a child's teeth decaying, or these kind of things. But it's like, what? Fluoride is not the reason we're in this situation. It's not fluoride. The reason a child's teeth are going bad, a teenager's teeth, and adult teeth are going bad, it's not because of lack of fluoride. That's not what it is. We want to consider the entire lifestyle, what's going on in our being. Once again, it comes back to food, comes back to nourishment, it comes back to a depleted person versus a nourished person.